Brian Davis is a triathlete. His collarbone broke when he crashed his bike.
It was my first competitive race. I thought I could cut it a little closer than I actually could. I tagged his rear wheel with my front wheel, and then everything just kind of tumbled, and I rolled around for a while and came to a stop on the pavement.
A fellow triathlete recommended Dr. Winston Warme at the University of Washington Medical Center's Bone and Joint Surgery Center. He's an orthopedic surgeon specializing in shoulder problems, including broken collarbones, a common injury among athletes.
The traditional wisdom has been to leave them alone, as they normally will heal up. And in the young, active child, these bones heal amazingly well. However, in adults, especially when the bones are very displaced and there's a lot of shortening at the fracture site, or the bone ends are far apart, then there's problems with healing. So over time, we've found it's more effective to intervene early on these fractures.
Dr. Warme repaired Brian's shoulder using a plate that attaches with screws to both pieces of the bone. The plate bridges the fracture site and restores the collarbone's normal length. As a competitive swimmer, Brian really needed his injured shoulder to get back to full function. He appreciated that Dr. Warme understood and appreciated his athletic goals.
He had dealt with athletes before, and so he understood where my values would be as opposed to, say, a reasonable normal person's values might be. The best thing I can say about the surgery is that it feels as though nothing ever happened.